Greetings, or Merry Christmas. My name is Enrique Daniel, and I will be talking about the major depressive disorder, which is a mood disorder, and it can be both psychological and psychiatric. This is varying on whether it's a chemical imbalance or based on feelings and emotions, psychological, or even both. Here are a couple fun facts, or not. It's the most common mental disorder out of all the mental disorders. It accounts for 40.5% of the disabilities caused by mental illnesses worldwide. Some of the symptoms, it's a condition characterized by one or more major depressive episodes without a history of manic or mixed or hypomanic episodes. It represents a decline from previous functioning, which most have at least 5 of the 9 symptoms. We have depressed moods, loss of interest or pleasure, significant change in appetite, weight, insomnia, hypersomnia, sleeping problems of course, psychomotor agitation, slowing, fatigue, loss of energy, feelings of worthlessness, inappropriate guilt, the inability to concentrate or indecisiveness, recurrent thoughts of death or suicide. It affects and it impairs academics as well, or occupational and social functioning. Well, some of the social skills that it affects are such as somebody's self-confidence. They feel inferior or shy. They're not confident on their skills or who they are, etc. Optimism. They're not. They have a lot of pessimism and they expect the worst in every situation. A sense of belonging. They fear rejection by others. They don't feel like they're part of a group. The ability to impair judgment. It generalizes anxiety, guilt, anger, and suicidal behavior. Some may become so depressed that they just sit mute and motionless. The sociability, they get socially withdrawn. Now we have spiritual factors as well to be considered. We're talking guilt, shame, condemnation, and other influences that are not good to somebody's spiritual life. Repentance, prayer, fasting. These are all factors that can affect the depression of somebody. Now we have that can be encountered when they're severe. The need for institutional care, phobia, excessive fear or of specific things, brief, unprovoked attacks of panic, drug or medication abuse, alcohol abuse, prolonged anxiety, attention or worry, overly dependent behavior, poor physical health, delusional or hallucinations, poor memory of learning ability, or poor grooming and hygiene. And of course, the biggest problem will be when somebody completes a suicide, and it occurs in the major depressive disorder up to 15% of the time with the individuals that deal with it. Now we have treatments and methods. We have such methods as preventing isolation or preventing stagnancy. People need to get occupied and interactive with friends, activities, schooling, at work, the gym, etc. They shouldn't continually be conversing about their depression or negativity. They should be practicing positive self-talk, positive thoughts, and things of that nature. Some of the treatments will be dependent on how severe the depression may be. It may be short-term, long-term. It's based on that. Does it involve chemical imbalances? There's antidepressants and things of that nature. Now we also have Christian counseling. Ministers or counselors who deal with emotional, physical, or intellectual life and ignore the spiritual core of the crisis and not responding to the whole person during the crisis. Because of their high psychological accessibility, people may be especially receptive are prone to hear issues of faith because of that. So, in other words, people need Christian counseling, because a person is not just a mind or a body, but we also have a spirit as well, and it all makes one.